The reason why I chose my specialty is that there was a number of things that I rotated through during my last 2 years of medical school, and went through cardiac surgery, cardiology, interventional. But the very last thing that I rotated through was cardiac EP, and I was captivated by it, by the fact that you can interrupt, cure arrhythmias, and restore normal quality of life for most patients. There is a group of patients that come to us because they have ventricular arrhythmias or atrial arrhythmias that require some ablation from primary care doctors or cardiologists. But there's also a large group of patients that come as a second or third opinion. And we spend in clinic, in the outpatient office, as well as in the hospital, a long time with patients and with their families to try to explain what their problem is. And they've never left our office saying we don't have a complete understanding of what's going on. Actually, most of the times they say, most of the stuff you told me, nobody's ever told me before. I do hope to explain thoroughly what the problem is and come up with a shared decision with patients and with their families. And I want to really make sure that I spend enough time with them so they fully understand what's going on, they fully understand what are the different treatment pathways, so we can come up with the best decision for them. And that's really what I care about. Some of the procedures that we perform here are very unique to this place. And for example, there are a series of patients that come because they have no other solutions in terms of the access to the heart. And we pioneer some ways to get access to these areas that up to that point were not considered accessible. And that's the reason why they get referred here. But the unique part about the Cleveland Clinic is the breadth of the program that includes a variety of specialties that all communicate with each other in the best interest of the patients. My end point of my, of course, professional career is to find solutions that are as effective as possible and as safe as possible for patients. Part of my philosophy, really, and my DNA, I would say, try to improve on myself constantly. And I think this is really key to find new solutions and better solutions for patients.